Well, good afternoon, ladies and gentlemen. My name's Will Fowles, and I'm the member for Burwood in the State Parliament. And it's my absolute pleasure to be hosting today a webinar for all of you into youth mental health. It's clearly a hugely important issue. It's an issue that resonates not just in our community, but right around the state and indeed right around the nation. I begin, of course, by acknowledging the traditional owners of the land upon which we are meeting. In my case, it's the people of the Wurundjeri and Bunurong nations, and I pay my respects to elders past and present, and I acknowledge on behalf of the entire panel and my colleagues the traditional owners of the country where they are as well.
Right.
Well, we've got an absolutely terrific panel who are primed and ready to go. But before we do that, it's my great pleasure to introduce my colleague, Steve Dermotlas. Steve is the member for Oakleigh in the State Parliament. He's the Parliamentary Secretary, just like the Assistant Minister to the Premier, and also, and importantly, the Assistant Minister for Mental Health. He's going to give us some introductory remarks about what the Victorian government's doing in this space, and then we will together put some questions to the panel. So without further ado, welcome again, and thank you, Steve. Over to you.
Thank you very much, Will. I'd also like to acknowledge the traditional owners of the land upon which we all meet, wherever we may be, and pay my respects to the elders past and present. There's a lot to say, so I'm going to try and contain a summary into literally 4 or 5 minutes. But first I want to acknowledge Will. Will recently had a youth mental health forum maybe 6 weeks ago or so with a bunch of young people in the electorate, and I'll tell you, they were fantastic, and they were so in touch in terms of the service delivery aspect, the policy nourishment in this whole area. They were really, really amazing people to listen to. So thank you, Will, for bringing them together. But look, I just want to give you a sense. A lot of this stuff you would know, but there is no bigger commitment that we have as a government than this reform, the mental health reform. If you look at the history of royal commissions, they unfortunately often follow a scandal. You know, we've had 2 royal commissions that are actually about public policy and social policy. That is a family violence royal commission, and that is a royal commission into the mental health system. That's kind of the level of the benchmark of our priority in this area. We came to office 7 years ago, and we established almost 7 years ago, and we established then under Foley as Minister Foley back then at the 10-year mental health plan, and we established an expert task force around it. But after a couple of years of good work, we realised that the problem was much, much bigger, systemic and entrenched. And despite the extraordinary work of the people that work in it, including the people on the panel here, that the system was letting down too many people and was re-traumatising people, including, mind you, can I tell you, many of the people working in it, insufficiently staffed, just not talking as well as the staff worked. The system wasn't talking to itself and wasn't coming around and encapsulating the needs of Victorians. So we decided on a Royal Commission, and we announced that towards the end of 2018. It spent 2 years doing an enormous amount of work, and some of you wouldn't know this, but it still holds a record as the biggest public inquiry in terms of, you measure the amount of submissions that come from the Victorian community to the Royal Commission, biggest ever in the 160 odd year of Victorian history in terms of the Westminster system. And it was effectively, if you think of it through that prism, it was the Victorian community telling us what it wanted in a mental health system, not us telling the community what it wanted. So we have an enormous mandate to do this. And we started off really strongly, I think, with a commitment the budget before last, for over 800 million to start implementing the initial recommendations, the preliminary recommendations of the interim report. And then we added to that 3.6 billion in this budget on May 20 to start in a more earnest way implementing the rest of the recommendations. So effectively what we, just a real quick snapshot, there's many ways to cut this, but there are effectively 7 key areas of reform. So a new mental health and wellbeing system with community-based care at its core, so early treatment in the community rather than late in hospital, including quite appropriately for this forum that Will's hosting today, is 2 separate service systems for young people. One for young people, so infants, young people, right up to the age of 25, and another service system for adults. And we're apparently one of the only jurisdictions in the world to move to a model like that. Mental health system that is responsive to people's level of need. So starting off at the community level and right through to the acuity level down at in terms of tertiary and statewide service delivery. And so you start at the community, but there's escalation points along the way. The third one is promoting good mental health and wellbeing and preventing suicide where people live, work and learn. Again, the community model. Fourthly, supporting all Victorians to experience their best mental health and wellbeing. So literally targeting not just a mainstream service delivery model, but specific vulnerable cohorts, including the Indigenous First Nations people of Victoria, LGBTIQ+, culturally and linguistically diverse, and other groups where they seem to be overrepresented in the mental health in the mental ill health system. The fifth one is new system foundations underpinned by lived experience, leadership, and strength of workforce. And I hope we have chat about this later, Will, but the lived experience workforce was one of the best recommendations coming out of the Royal Commission. What an extraordinary opportunity for people who've been through the system to actually then offer to be part of the workforce. It's for many of them, it's therapeutic and good for them. But for the consumer on the other end, it's extraordinary to have someone with lived experience. And the last two was, the sixth one was leading research and innovation to continually improve mental health treatment, care and support. So really understanding that this is a system that won't just stand in place for too long. We need a collaborative approach to research and translational research in this area. So we're setting up a collaborative centre and a whole bunch of other work to ensure that reform and continual innovation is at the core of the system. And the last one is building the mental health and wellbeing system of the future. And that literally is a catch-all, but a bunch of different models from Thomas Embling at the acute end of the spectrum right to community-based beds, drug and alcohol, and a range of those other supports. I think I went over 5 minutes, but very happy to, and I spoke very fast, but there's a lot. And I just want to leave you with this. You work in the system. You know that for many people, it's effective. And for you, it's often managing queues, managing expectations, and trying to connect people to sometimes disconnected, fragmented systems that are only connected because of your work, are only connected because of your networks. And, we want to change all of that. It's a 10-year reform journey, but we've started really strongly. And why I have confidence in this is beyond the life of our government is that we've instituted a revenue system for the mental health reform work that will outsee us, that will just last for years. And that is mental health levy, which 5% of businesses in Victoria will pay, subject to payroll, kind of where they sit in the payroll scheme of things. But that is a guaranteed revenue source for these reforms ongoing. So mental health will no longer have to compete with the normal kind of cut and thrust of budgets by different governments, whether we build a road over here or 10 new schools in the growth areas of Melbourne. Mental health will have its own funding source. That's why, as hard as it is now, I really strongly know that we will continue to reform because the budget will be there guaranteed. Thank you so much, Will, for the chance.
Thanks very much, Steve. We've already had a question about what materials might be available to explain those 7 points that you've raised. What we'll do is I will put that up on our Facebook page and make sure that it's available for everyone. So thank you. Thanks very much. Our first question for the panel is about preventative health, but let me use this as an opportunity to allow you to just give us a brief synopsis of the service you provide, and then maybe, if you can, point us to some of the preventative health measures and services and things that are out there that parents who are on this call might be keen to understand about. I might go, we'll go reverse alphabetical by surname. So that means Karen, you're up first.
Hello everyone, I'm Karen, the manager at Headspace Hawthorn, and we're opening a new centre in Malvern the end of this year. So Headspace services provide mental health, physical health, AOD and employment and education support to young people aged 12 to 25.
Excellent. And are there preventative health resources or programs out there that you think parents should be thinking about and looking towards as they're managing kids coming out of this lockdown phase?
Yeah, I think it's probably really in that early intervention. You've got sort of things like Headspace. There's a lot of information and resources on that website for parents and for young people, looking at beyond things like Beyond Blue support and social groups. Thinking about youth-friendly GPs is a really early start. You know, it's not most GPs at Headspace centres offer extended appointments, and so they can sort of be a really good early intervention service. And there's things to like the Head to Health website, and other parenting programs like Tuning Into Kids or Tuning Into Teens might be good early sort of intervention options.
Terrific. Thank you. Vanessa, you're up next.
Yeah, hi, I'm Vanessa Vergara. So my position is Acting Senior Coordinator of the Children, Young People and Families team at the City of Boroondara. Generally, my role is Youth Development and Program Lead for the City of Boroondara. So I'm here really to talk on behalf of the youth side of the team. We work with young people aged 10 to 25. I guess I'd echo what Karen has just talked about by way of some online services, which sounds kind of strange because screen fatigue is very real, and we're often encouraging young people to spend less time online, although there's some real anonymity around young people being able to get online rather than face-to-face, especially if it's their first time embarking on accessing treatment. I think there's some really good fact sheets as well. Headspace have some great fact sheets. Beyond Blue have some great fact sheets. We're in a really good position to have initial conversations with parents and or young people. We're not a specialist service, so what we provide is generalist support to young people, but a really good conduit between kind of that first step and getting young people linked into the specialist supports that they might require. So by all means, whether it's a young person or a teacher or a neighbour or a grandparent or a parent, please feel free to get in touch with us and we can have that initial conversation and point you in the right direction.
Thanks, Vanessa. Next up is Anna.
Hi, everyone. So I'm the CEO of Access Health and Community, and we're a community health organisation operating across the inner east of Melbourne. And we offer quite a wide range of services. So we deliver the stepped care model, Head to Help. Karen, who looks after Headspace in Hawthorn and soon to be in Melbourne, as well as part of the Access team. And we also offer a range of alcohol and other drug services as well, which often there is an overlap between that service system and the mental health system. I think one of the really, when we talk about prevention, I think one of the areas that's really important to talk about is parents and the really important role that parents and families play in prevention. And I think, you know, when I take a step back to early intervention, which is a term we like to throw around in the service system, I think the earliest intervention is actually just parents arming themselves with knowledge about the mental health service system, about what good mental health looks like, and actually being able to model self-care and good mental health themselves as parents. So, you know, I think going right back before we even engage with the service system, you know, thinking about things like mental health first aid training for parents. You know, a lot of parents go out and do first aid training when they have new babies because they know how important it is that if something goes physically wrong with their kids, to know how to address it. But actually, you know, thinking about that from a mental health perspective, I think, you know, that's something I would love to see all parents doing. So beyond their access to services, I think there's some simple things that parents can do in that space.
Fantastic. Thank you, Anna. Some great suggestions there. Jane, did you have anything to add?
Sorry, great unmute, yes.
And that's our first $1 in the jar.
Oh, no.
For the mute fail. It could be a very expensive day, I'll just warn you.
Okay, I've done it once. I won't do it again. Yeah, hi. So I'm Jane Layla. I'm in the same role as Karen Bogle, but across Headspace, Elstonwick and Bentley, and Sindel is our new centre, so covering kind of both your constituents areas. So yeah, as people have said, Headspace National does have a lot of really great resources, and it also has a great tool now where young people can set up their own kind of passport of resources, so they can pick up the things that are of particular interest to them. I think the whole approach now is much more focused on wellbeing, which is a really great thing, and that's what you're talking about as well, Steve, that we're really trying to look at that much earlier intervention and what does good mental health actually look like. And the great strategy Headspace National have, and they have quite a bit of detail, and each of them is the 7 tips to a healthy headspace, which is a really nice, simple way to break down all the things that we all need to pay attention to: healthy eating, exercise, but some of the really great ones are how you develop strategies for tough times. So those kind of things can be really great for having a plan before you get into the tough times. I think we all know it's hard to think when you're in the tough time. So preparing teenagers and young people to think in that way as well. So there's a plethora of resources there. The other thing they are doing, and I'm sure Karen's Centre and our centres are involved in, their Headspace National are coordinating a round of parent webinars, and they've had some fantastic, the first one was just a really general one, and now they've got some more specific topics that are really around understanding a mental health kind of continuum and what to look for and how you can support and tune into your young people and listen. And the tuning into teens that Karen talked about is really an emotional intelligence strategy, which is a really great approach as well. And I also think anything resilience based, I know there's the Resilience Project, really looking at, well, how do you use those tough times to turn them into developing skills and building resilience for life. Because as we all know, it doesn't get any easier as you get older.
Correct. Thanks, Jane. And finally to you, Sam. Thanks for being here.
No worries. I'm Sammy, and I'm the Senior Youth Worker at Monash Youth Services. We provide support for young people 10 to 25 that live, work or play in the city of Monash. And similar to Vanessa was mentioning, we're one of those really great places as a first stop shop. So somewhere to go when you're not sure where to go, because we've got access to not just referral pathways, but we do have youth worker support, which is free and confidential. We have a variety of youth development programs that we run, and we also do personal and skill development workshops and events. So there's a range of programs, and that really first step of support for young people, particularly if they're not confident enough to go and access a GP or a counsellor or a psychologist because that seems too large a step to take. We can definitely have that really soft conversation to begin a process. And just in regards to early intervention, one of the things I think is so important, which has been touched on already, is the idea of that educating families and parents that they know what the signs and symptoms are. They know what good mental health looks like and what to look out for, so that they can recognise those really early symptoms. And if they have the ability to do that, know where to go and where to seek support. So there are the programs that have been mentioned already and information out there that can provide families with that information. The other thing also is, with so much social disconnection, local councils, youth services like ours definitely provide that social connection, and that being online at the moment. But as soon as we're able to lift restrictions and move into that space, we'll be shifting those back into person again. And the importance of connecting in programs, and that can be just social programs to better mental health, but also can be part of that early intervention process as well. So so we have lots of those programs that people can obviously access on our website for more information.
Fantastic. Thanks, Sammy.
Sorry,
Having another look at, Dimo, please.
I know you're running the show here, but I just want to quickly add two things. This was such an interesting conversation. I just want to add one thing about the early prevention and prevention and early intervention, particularly around what Anna Jane and the entire panel was saying. Part of one of the small benefits of the time we've been through the last 21 months is it's actually created a permissible environment to ask anybody how they're doing. Like usually you don't, if you think back before this time, you don't ask people that question. It was too hard. So this has, in my view, has rapidly accelerated the destigmatisation of mental ill health because it's okay to ask people. And I think that is one of the enablers of prevention, of early intervention, is actually having the courage to say, I'm not okay. So I think that's one thing we should all look back on in some sense with a bit of appreciation that we've had this community conversation internationally because of the pandemic. And the second thing I was going to say, which is pretty exciting, is that Vic Health was established decades ago. It started off as a health promotion office for physical health. I mean, it's more than other things. The recommendations of the Royal Commission has tasked us with establishing a mental health promotion office. Could you imagine that? Like, from not talking about it 5 years ago to actually having a statutory office for health promotion. So I think that will be really critical for the enablers of what we're just talking about.
Thank you very much, Steve. So what I thought we'd do in just thinking about these questions is sort of ask you to help us walk a bit of a journey from someone who may be exhibiting some symptoms of mental ill health all the way through to treatment. So the first question then is, what are the warning signs to look for teenagers, particularly, I guess, experiencing mental ill health? I think one of the challenges for parents is what behaviour is teenager behaviour and what behaviour is there's something actually amiss here.
Understand what adolescent development looks like. And so once you've got a clear understanding of what adolescent development looks like, something that sits outside of that, as in change of behaviour or something that's not every day for your young person, that's when you can start sort of thinking, there's something that's a little bit amiss here. Not that I want to monopolise this, but I think one of the really important things for parents is to have a conversation with their young person, but come from a place of curiosity and come from a place of kindness and not a place of judgment or, we would have conversations with our friends from a different perspective and everybody's busy and you're walking the dog and doing the grocery shopping and doing all of that sort of stuff. But I think it's super important to have really kind and curious conversations with young people, because some young people will disclose pretty quickly what's going on for them, bearing in mind too that they don't have the same language as adults do. So, some just really good lines to use with young people is, okay, so what does that mean for you? Get them to try and flesh out what that looks like for them. I think that's just a fairly simple and manageable way to start a conversation.
Thanks, Vanessa. Jane?
Not doing that twice. Just following on from what Vanessa said, I think you're right. Like it is responding with kindness, because I live in a house with 3 teenagers, and often the change in behaviour can be quite irritating when you're living in the house. It'll be the fact that they're doing something that is kind of, not doing the dishes or not, the things that are irritating. But actually it's, if you can step back from that and notice what is a change in behaviour, because as you said, I think at that they're emerging adults and they're not able to articulate what they're feeling. And so sometimes they won't even know what they're feeling, but they're responding. And so you see the behaviours more than the what's actually going on for them. And my second point is there's actually a great thing called the mental health continuum, because I think, as you said, Will, there's the whole issue of, well, is this normal teenage behaviour or isn't it? The staying up late or the being a bit grumpy but it's the thing that's great about the mental health continuum is it talks about, well, okay, if you're just seeing it, but then there's a lot of kind of happy behaviour as well, and they're still engaged with their friends and they're eating okay, then it's teenage behaviour, and it's actually then important not to overreact to it. But it's really about where you're seeing those behaviours for an extended period of time. And, some people say, if it's a month, but I think, if it's really more a couple of months where you're really starting to see withdrawal, no contact with your friends, the grumpy behaviours there more of the time than it's not, that's when you really need to start asking questions and thinking about what might be going on for your young person. And the other one that is a really great resource is Beyond Blue, and I can give the resource. It's about it, but there's a fantastic video that really is targeted for parents about how do you just sit and listen and inquire about what might be happening for your young person. So yeah, that's
thank you, Jane. So what we'll do for the benefit of everyone following along is we'll gather up all these resources and post them to my Facebook page, or of course you can email me and we'll send you out all the links, the attachments, the PDFs, whatever. But I think that mental health continuum and Beyond Blue video would be terrific as a start. Now, did anyone else have a contribution to make on this topic? No? Very good. All right. So we've had a bit of a think now about what to look out for. There's, I guess, two categories of person who might be concerned. There's the obvious one in the familial relationships, and there are those who are professionally supported to look out for young people, like teachers. But what if you're just a neighbour, you're not a family member, or you have some contact with a young person, you're worried about their mental health? What is the best approach to that situation to take, do you think?
I think that it's definitely worth considering what relationship you do have with the young person first. If you have a relationship where you can ask that question of how they're going and check in, then it doesn't matter who you are if you're being curious and kind, as we've talked about, and you can give them the opportunity to have a voice in this situation, because one of the things is that a lot of people are assuming how people are going, or assuming that they know what the experience, particularly in lockdown or home learning, has been like. So I would encourage anyone who shares that relationship of some form where they can communicate and have that conversation to check in and see how things are going. Now, if you don't have that relationship and that's not an option, it can be great if you've got the connection with a parent, or if it's a teacher or a student wellbeing coordinator, or someone else in the circle, to share your observations and show your concern, and ask maybe if they have the ability to check in with the young person about how they're going. But it's important that someone is starting this conversation and not just assuming that someone else is going to take ownership of that.
Thanks, Amy. Anna.
Yeah, I think one of the things that's really important is that when you're having those conversations, that you're really careful to not promise that you're going to keep any secrets, because I think that you can end up in a really tricky situation there, where if there are things that are disclosed which are really serious, that you then find yourself having to break a confidence. And I think it's really important to sort of set those boundaries in those conversations. But again, sort of taking a step back, I think one of the really important ways that you can raise this topic is actually to share and be really open about your own mental health. And I think, you know, this is, again, creating this environment where it feels normal and comfortable to be talking about mental health in the same way that we would talk about any other health condition. And, you know, I think some of the great conversations that I've seen in our workplace and amongst our employees and our volunteers and our clients have been, you know, just this authenticity that people have had over the last 18 months in particular, about going, you know what, I'm really struggling, I'm feeling really flat, I'm feeling really down, I'm seeking help. So I think sometimes that can be a way to open up a conversation that might not have been as comfortable for people previously.
Did anyone else have anything to add on this topic? So why don't we step forward then? And I think there's a perception amongst some of the community, some reticence about, you know, presenting their child for an assessment, even in this space. There's the fear of, oh, well, they're just going to end up being medicated, or, you know, they're going to have their minds filled with a bunch of mumbo jumbo or whatever. Can you just give us a bit of an outline, perhaps, of the typical, not that there is one, but, you know, the sort of things that parents could expect if they presented to one of your services with their young person, and what actually happens at that juncture?
So I could speak on, I mean, most headspaces are sort of a bit similar, but the first point of contact is just giving us a call. Like, the young person might not be ready to access any services, but Headspace is a family inclusive service. So we do provide some support and maybe ideas for parents. even to if young people were to call Headspace, it's just an initial discussion over the phone. So it's not about getting anyone in, getting anyone medicated. I mean, that's probably at the far end of the scale. It's really just having a chat to them about what's going on, and that can then decide whether we need to maybe do a further assessment. It might just be there's some situational issues going on for them and we can do single session where they just come in for a once-off session. So it doesn't have to be, it doesn't necessarily have to be a scary thing. We are a voluntary service, so we will provide whatever information is needed, and then we encourage people to call us, email us, and just keep those communications open.
I think one of the really important things, and I can speak from our service, is that we're not coming in with a client in a room with an agenda about what we want to get out of that session. It's all about meeting the young person's needs and the young person's goals. So yeah, so young person needs to consent when they are coming into the service, and it is their choice to be part of the service, but they have that that accountability and responsibility to leave whenever they want. It's their choice to be there, and they are leading the way in what support they are wanting. And no one is there with that pre-planned pathway for that young person. It's the workers supporting the young person with the skills and the strategies that they have, but based on what the young person is asking for or looking for.
It's a very difficult space. What are the confidentiality kind of assurances? Say a young person is coming out or something and doesn't want to tell their parent, but wants to seek help, or it could be anything really. It doesn't have to be that, or first sexual experience or whatever, but it's really there's something I need assistance with, and they come to you, but the family also wants to know. Can you, maybe Vanessa or whoever wants to just cover that off in whatever you're going to say anyway?
Thanks, Steve. So maybe we'll go to Vanessa yet, and if you don't want to pick up that topic, that's fine. We'll throw to the panel after you.
No, I'm happy to. What I was just going to say very quickly earlier too is it's really important to support the parents, and often we'll have conversations with parents, and what we can establish through that is they don't have their own support network, so they're doing everything possible to support their child or young person, but sometimes it's about us recommending some referral options and some support options so that they can get their own stuff regulated to better support their young person. So I think that's important. With regards to confidentiality, we explain confidentiality to young people right at the very beginning. So if someone's just coming in to have a game of pool and a cup of coffee, happy days. But if it's one-on-one support, right from the get-go, we explain to young people that what confidentiality is, what would need to happen for us to breach that, why we would breach that, and the process around doing that. So we would say to a young person, hypothetically, if you were to disclose that you were going to go and physically assault someone, or and we thought that that person was at risk and we needed to breach your confidentiality, then this is how it would go down, and we would have a chat to you about this, and this is the process that would take. So I think, Steve, in answer to your question, it's a little bit about what's going to cause harm. So our sort of confidentiality is around if we think a young person's at risk to themselves or to somebody else, that's when we would step in and breach, and our duty of care to keep the young person and or others safe would override that confidentiality for us. But if it is something about, I'm considering this or I'm thinking about that, that's not something we would disclose.
To all of our panel, thank you very much for being here. If I can perhaps put in a request, I think we're going to get lots of great feedback about today's session, and I think we're going to have lots of questions that come out of today's session. So if I can perhaps put in the request that we reconvene at some point after re-entry, after the sort of pseudo-normalisation of our lives, and see if there's more questions that people want to cover off. But thank you from the bottom of my heart. Thank you very much for being with us today. We're very, very grateful for your time. And with that, we will end the public part of the webinar. So thank you to our constituents, our friends who've been joining us today. Thank you very much for being here. And I'll ask the panel to just stay on for a moment.